Welcome back to the RevMD podcast with me, your host, Dr. Deborah Durst, and I have a special guest with me today, Cathy Eason, who is the Chief Science Officer for Berkeley Life. And so welcome, Cathy.
Thank you so much. It's my pleasure to be here today, and I'm just looking forward to our conversation.
Well, and we were talking a little bit before we got on camera just about your history and your background and what kind of led you to this position. So, would you mind sharing some of that again with us, even though it's a repeat?
Sure.
It wasn't on camera.
Yeah,
So,
no,
yeah.
yeah, it's okay. I am a functional clinical nutritionist for over 20 years now. Lots of experience working with patients from a broad spectrum of health conditions to improve their diet, but also using targeted nutraceuticals to try to bring them to new plateaus and healing. I came to Berkeley Life after several years of using the product for myself clinically, and I really was sort of looking for a team to join to do more of this educational outreach on the role of nitric oxide in many facets of health across the body. And I think I found my team, and I know I found the product a long time ago because I know how it's helped my patients. And now I'm just excited to share the education around the role of nitric oxide in the body so that men, women, everybody can age healthfully and with vitality throughout the health span and throughout a long, long life.
Well, I love all of that. And I do love the fact that, like, with your nutritionist background, you know the importance of just nutrition on different cellular processes. And the fact that you use this and this product is a nutrition based product that's giving us nutritional components to increase nitric oxide. So that ties together very well. But maybe talk a little bit first about just the nutritional pathway for nitric oxide production, because I think people so often focus in on the amino acid pathway.
We do. Yeah. I would love to talk about that because they're two complementary pathways. And because of just increasing oxidative stress that most people and most practitioners are seeing in their patients, we need to utilize both pathways to generating nitric oxide in the body. The exogenous, or also known as the enterosalivary pathway to making nitric oxide, comes from the diet, and it comes from the healthful foods that you would consider everybody should be using, but nobody's getting quite enough of. And that's simply your leafy green vegetables, things like spinach, arugula, kale, beet greens and beetroot, celery. One of the favorite kind of foods I like to talk about because it's seasonal right now is rhubarb. Not a lot of people think about rhubarb as having a nitrate concentration, but it's a really nice addition to the diet for lots of reasons, but specifically for the nitrates. So we are designed physiologically to ingest nitrates, to chew our foods really well, to break them down through both digestive and enzyme processes, recycle them, and then reutilize them with a half-life in the bloodstream of only about 8 hours. So it's not something we can build tolerance to. We have to keep ingesting these dietary nitrates that we then recycle. And we also utilize the assistance of oral microbiome and the gut microbiome, which have certain species of bacteria that help us reduce nitrates to their smaller components, making nitric oxide to fuel all the signaling mechanisms in the body, starting with improved blood flow.
And it's interesting because do you frequently find that people think they're taking nitric oxide when they're supplementing? I hear it all the time. Even actually from our office, we're like, well, when I take the nitric oxide. And so I think it's such an important point to clarify that it's not nitric oxide you're taking. You're taking something that will help you produce it in the body.
Absolutely. You're taking the raw ingredients to produce nitric oxide internally. Nitric oxide is a gas. It is used, interestingly, in inhalation efforts in certain laboratory settings, in treatment and like pediatric asthma and things like that. But it's not something the average person is going to be able to supplement as a gas molecule. So we have to provide the raw ingredients, the substrate, which are dietary nitrates. It's a molecule that the body breaks down through, again, through the help, with the help of the oral microbiome, to smaller components to produce that gas that only lives for milliseconds to a couple seconds in the body. But in that brief period of time is an amazing signaling mechanism that happens. And there's really not a system that nitric oxide in the body doesn't touch. So we know it has multiple roles in not just promoting blood flow, regulating blood pressure, regulating heart rate. It also plays a role in immune function, in digestive function, and blood sugar regulation, in metabolism, in hormone balancing, in neurotransmitter balancing, in nervous system toning. So the longer we study this tiny little molecule, the more we know. And it is interesting to me that a lot of people also confuse it with nitrous oxide. Like that's your laughing gas that you would get at the dentist. We're also not supplementing with that. We're giving our body the raw ingredients that we're missing dietarily. And we're not always missing it because we aren't eating those healthy foods. We're missing it because the soil concentration of dietary nitrates are not as concentrated as they used to be. Nitrate concentration varies in spinach between regions, depending on time of year it's harvested. I've even seen some studies talking about moon phases having an impact on nitrate concentration in leafy green vegetables. And then couple that with the amount of loss that we're using. We're using more nitric oxide than our bodies are able to produce. So we need to have a way to make up that nutritional gap. And that's where the supplementation comes in, to keep nitrate levels consistent in the body so that 24 hours a day, we have the capacity to break down the molecule to the gas, nitric oxide, that then carries on out its signaling mechanisms.
And then involves every cell system in the body. That's so important. So important.
Every cell system, yes. And I think, if we want to talk about even deeper than that, at the organelle level, nitric oxide signals the mitochondria to regenerate themselves. It's through the process of mitochondrial biogenesis. The number one symptom improvement we hear from people taking Berkeley Life Nitric Oxide Foundation is increased energy. And, there's so many people not sleeping well, failing to wake up on time, slugging through their day, reaching for caffeine in the afternoon because they simply don't have the energy. And we know that by giving the body the substrate to boost nitric oxide levels, we're going to improve that mitochondrial biogenesis. You're going to feel the uptick in energy and oxygen utilization through the body. It's really palpable, and it happens really quickly. Within days, people will feel the energy increase.
Yeah, that is so important. And who doesn't want more energy, right?
Exactly. I think and you'd probably agree, the number one symptom that people are coming in with is, I'm just so fatigued all the time, and it doesn't seem to matter. I can never catch up on sleep, and I can never, feel rested enough. And lives are busy and lives are full, and there's a lot of stress of all different kinds happening for us. And all of that takes a lot of energy to navigate on a daily basis. And I think you're right. Everybody wants more energy.
I would say that we will ask like top 3 things if we have hormone patients coming in, like the top 3 things that you want to see improved, because everyone's different and women are different than men. But almost consistently, of the top 3, energy is one of them. And so I think everybody wants increased energy. There's very few that come in saying, I'm good with energy, don't need any more. So no, I think that's important. And I didn't really we talk about NAD being mitochondrial support a lot, but we didn't actually talk specifically. We talk about increased blood flow and all the benefits that go along with that, but not the specific mitochondrial support that you just mentioned. So that's super important as well.
Well, and NAD plays a role in nitric oxide production through the enzymatic pathway using L-arginine, the amino acid. But as you know, it's a common deficiency in a lot of people. And when that deficiency is present, that enzyme function doesn't work as well. There's lots of other reasons why we're finding the enzyme function is depleted. We call it enzyme uncoupling, when the enzyme doesn't function as it should. And it's usually a loss of necessary precursors to feeding that enzyme pathway. At the same time, we're also learning more about genetic studies and how there are many people with genetic variations that don't allow their nitric oxide synthase enzymes to work appropriately, which is all the more reason we need to feed the complementary pathway for NO production through the enterosalivary pathway with dietary nitrates. When you consider that 9 out of 10 American individuals do not eat the minimum recommended amount of vegetables daily, you can start to see where the deficit begins. And even if you are feeling like you're eating enough vegetables, and especially those dark leafy greens that are very nitrate rich, there's still the changes in soil composition and the lack of consistency in the vegetables we are able to get that requires that us to have something to bridge the gap. And that's where the supplements come in handy.
Perfect. Well, I want to summarize it in very, simple terms, because to me it has to be simple. And I also get that frequently the patients are like, it's a lot of science and it's a little too much. Can you just simplify it? So, and that's how my brain works as well. But so basically, nitric oxide affects every cell in the body and every cell, every organ system. And there's two pathways to production. One is the dietary that we're talking about, and that's what Berkeley Life has in it, is a bunch of nitrates in a supplement. So you're really taking a nutritional supplement that's providing you with all the nitrates for the nutritional. I know you call it the enterosalivary pathway, but I think that a lot of times that's just our dietary GI, system. And then there's the amino acid one, which I hear so many people talk about. And that one does deplete with age, is what you're saying. So it's not as effective as we get older. So taking the dietary supplements that we need, or the Berkeley Life, provides all the nitrates we need to produce the nitric oxide and bypass that amino acid. Not bypass it, but we're working it through a different pathway to get that nitric oxide that we need for all the good things to happen in the body. Right?
Absolutely. Absolutely. And there's evidence that by using the dietary pathway, increasing your nitrate intake, you're going to heal the inflammation in the very tissue where that other pathway is active. So it's win-win. You're going to promote the health of that more internal pathway. At the same time, you're bringing in dietary nitrates that keep that level of nitric oxide consistent 24 hours a day. That's what we need.
Yeah, that's awesome. And we just recently had another product. It was basically more like topical stuff, but it was another product that was talking about nitric oxide production, but it was all amino acids. So again, I think it's okay to take that. I hear a lot of men with the L-arginine, and so I try to say that that's still okay. But, you are going to get the nitrates with these two capsules, and you can actually test. We'll talk a little bit at the end about the salivary strips and all the testing that you can do. And we'd like to do that in the office, give somebody 2 capsules, have them test before, and then test a couple hours after they leave. And then they can see the improvement. And that's super helpful for people to be able to see something objective.
Right, because now you know that you're actually taking something that is working for you. It's making a change, a beneficial change on the test strip. I also find those test strips very encouraging to patients, meaning they do the before and after testing in the clinic. They get home, maybe they do another test in the afternoon, and they're like, oh, Dr. Durst told me I should probably work on my breath work or take a walk or make sure I eat leafy greens with my dinner. Now they're more compliant when they're using these test strips to sort of track their patterns and see where they're at in terms of nitric oxide status.
Yeah, no, I think it's awesome. Objectivity, you can't argue with some data or something objective. So it comes to like one of the things that we're passionate about our office, and I know you guys are too, is sexual wellness. And, that's not all of it. But obviously, when people age, men or women, they're noticing changes. And so there's lots of things we can do from a regenerative standpoint, but we like to be comprehensive. And so talking about women, for instance, because I know you guys had a recent study that addressed female sexual wellness. So I'd really love to go into that and what nitric oxide does for female sexual function and how to improve it. So tell me a little bit about that.
Okay, well, we are excited about these studies for both women and a future planned men's sexual function trial as well. But let's be honest, in the literature, there's lots of studies on male sexual function and not as much about female sexual function. Both sexes require adequate blood flow to the reproductive organs for sex to even be possible, and especially for it to be comfortable and satisfying. And at Berkeley Life, we feel like a healthy sexual function through the lifespan is a quality of life indicator. And we feel like it's really important that we get the education out there and we talk about it. So we have done some clinical trials knowing that if we're going to use nitric oxide support and some of the other medications that improve nitric oxide bioavailability in men's sexual function, wouldn't it make sense that we also need to increase blood flow in women's sexual organs as well too? So that's the premise of it. So we have done both now a clinical pilot study with great results that led us to a longer, or should I say a larger phase 1 clinical trial. And then we have a second phase planned for 2026. And we're excited about the results. So the concept being using female sexual function index surveys, tracking both the Berkeley Life test strips, but also salivary and plasma levels of that raw ingredient, nitrate, in the body. We're able to see how boosting nitric oxide production contributes to female sexual function. And the first results from the pilot study were pretty impressive. 83% of respondents reported an enhanced orgasm sensation. At the same time, they also reported less painful sex. What's happening is we're boosting blood flow. Blood flow to the sexual organs makes for better receptivity during sex. It also promotes, we found 72% of the women reported increased lubrication. That's a big piece of having non-painful sex and having it feel enjoyable. We also noticed some markers in the follow-up pilot study, still the same responses to orgasm and desire. We know that boosting nitric oxide boosts blood flow, that better carries the hormone signaling that's happening, and that includes the signaling of oxytocin, your love and connection hormone. That has a lot to do with desire and arousal and interest in sex in the first place. We saw a 58% improvement in libido, and we saw some other interesting things in the main trial, the phase 1 trial. The subjects were also wearing an Oura ring, and then we were collecting some biometric data on them. And we found some interesting, not quite statistically significant, but some directional trends that we feel in a longer study would be important for showing that nitric oxide boosts sleep quality and also helps calm the stress response. How does that relate to sexual function? Well, it's pretty hard to feel interested in sex if you're tired and you're stressed and there's some underlying anxiety. So we're hoping to see with a longer trial and a larger population subset that when we collect those biometrics, we're going to see longer term improvements in both sleep and your ability to adapt to stress responses, which to me suggests just a calmed nervous system that has so many other implications in a balanced life.
When those that were wearing the Aura ring and following metrics, what exactly were the sleep results with that they were noticing?
The sleep results were improved sleep, less, easier to fall asleep, easier to wake, more wakefulness in the morning upon rest, less anxiety. We saw some beneficial changes in heart rate variability, but again, we need a longer term trial to show that clinical statistically significant aspect. But the trends are there, and we're excited for future trials to see more of that.
And well, that's quite impressive data overall, because you're talking about desire, lubrication. And again, I think what people don't understand, including physicians sometimes, is that lubrication is a function of blood flow. So if you're improving blood flow, it's ultrafiltration of blood flow, and then that's lubrication. But you guys had decreased sex, like increased orgasmic strength, even libido. That's pretty impressive, because I tend to say like libido is like a systemic, and then we have the regeneration or the local, tissue response. And libido to me is more of a systemic. So that is, again, speaking to almost, in my mind, also brain function that's improving with that.
We know that when we improve blood flow systemically, that's also improving cerebral blood flow, better oxygenation of the tissues. We know that nitric oxide plays a role in autonomic regulation of neurotransmitters and actually acts as a retroneurotransmitter, sort of sending a reverse signal to the brain that we need more cognitive function. We need more initiation, better dopamine response. We need a mood balance and regulating serotonin. Serotonin then relating back to women's health and even sexual function, serotonin be important in thermoregulation. So we're seeing some menopausal signs like hot flashes and night sweats and things like that be improved by boosting NO to have the secondary effect of that neurotransmitter regulation. So I think the science is exciting. I'm looking forward to seeing more of it.
With this, and this was a pilot study that, well, it was a pilot in a phase one. So with the pilot study, how long or was that study done? And even with the phase one, like what are they supplementing and for how long was that study?
Yeah, the pilot study was 60 days of use, and the standard dose of Berkeley Life NO Foundation contains 500 milligrams of dietary nitrates and some cofactor ingredients to help improve blood flow, vasodilate blood vessels. They took 2 capsules per day for 60 days in the pilot study. In the phase one trial, the study was only 30 days while they were also wearing the Oura ring to collect the biometrics, but with the same 2 capsule dose per day. Very simple to implement, especially with the testing.
Mm-hmm.
Easy to take once a day, sometimes beneficial to take in a split dose, 1 capsule twice a day. Really easy foundational support. And what I can say from a nutrition clinical aspect is I also see that when we start to boost blood flow, we see the need for less and less additional supplementation. We can reduce the supplement burden when blood flow is happening better, when better nutrient and oxygen delivery is happening, when every cell in the body is having renewal at the mitochondrial level. I start to see that there's less need for me to have like stress adaptogens,
Mm-hmm.
maybe fewer digestive aids, blood sugar regulation aids, things like that. So I find that really important from a total health perspective because I want patients to be thriving with food and lifestyle as much as possible using these important supplement tools as a tool, but we shouldn't have to crutch ourselves up with so many additional pills every day.
Well, and it brings me to, I do, with your background and 20 years in nutrition, I would love to hear just some key like bullet points that patients would know, or think about from you with all that experience. And then also what kind of supplements, like basic supplements, because I'm sure that there's some, basic things that you think that are, pretty beneficial for most patients. So I'd love to hear that nutritional part and that, supplement, like a basic, like kind of entry level supplement that our audience and listeners could hear and take away from this.
First of all, I don't believe that there is a one size fits all diet for everybody. We have to look at our heritage. We have to look at whether we're more sedentary or more active. We have to look at our stress patterns. And, we're also feeding families. And so it's not always conducive to personal health to eat differently than the rest of the family. So, with all that taken in, there's no one size fits all diet for everybody, but there are certain parameters. Women, especially in the aging process, and as they are looking to maintain sexual function throughout the ages, we need a greater amount of protein. The evidence and the science is really there. So, getting protein consistently every day and spread apart between every meal is very, very important. From a nitric oxide standpoint, we could talk about all the nitrate rich foods that I've already mentioned, the leafy greens, celery, spinach, beetroot, things like that. We also get some dietary nitrates in things like eggs and fish, but the concentration really isn't there like it is in the vegetables. The other thing that the vegetables provide are fiber and
Mm-hmm.
really important polyphenols and other micronutrients, minerals especially, that are very important as signaling agents themselves. I call minerals the spark plug of life. We need them for every enzyme function in the body, and you can't have good hormone balance without a good mineral balance. So making sure you're getting multicolored vegetables and fruits in your diet on a regular basis. Some of the things are pretty well known in the mainstream, but we succumb to them. So limiting sugar, limiting or avoiding alcohol completely, limiting caffeine intake, drinking pure clear water, all the really kind of basic things that we've learned over time Some individuals, based on their health presentation, might need a higher fat diet. Some might need a reduced carbohydrate diet. Some might need more protein than others. That's why I think it's worth working with a professional to get that, that information. And then in terms of supplements, the longer I've worked in nutrition, I'm really hopeful that people are making not only the diet, but the lifestyle changes I want them to make, including exercise and sleep hygiene and stress reduction and being in community and enjoying nature and getting natural sunlight and all those things. When we do those things, we tend to reduce the need for all the other shiny, glitzy marketing ploys in the nutrition supplement industry that get thrown at
Mhm.
us. I think some of the foundational pieces are, I'm a really big believer in vitamin D3 levels, having them tested. Vitamin D3 and nitric oxide have a dual role in signaling each other. We know that sunlight helps us initiate more nitric oxide production. That's going to open up blood flow and carry vitamin D3 around the body. It's sort of nature's perfect little combination there. So I think vitamin D3 is an important nutrient to consider taking. Um, Probiotics, because unfortunately, a lot of people aren't eating enough dietary fiber, and then they have other elements of their life that are compromising the integrity of the intestinal microbiome. So I'm a believer in probiotics, but also doing some testing to learn which probiotic might be right for each individual, changing them
Mhm.
up a little bit. And then I think my other sort of broad spectrum approach would be omega-3 fatty acids as an inflammation management tool, in addition to dietary nitrate support for nitric oxide production. So my supplement stack is pretty light. And then supplements should be considered as just that. They're an augment. They're a supplement. A lot of things don't need to be taken on a regular basis for the rest of your life, but it also depends on all those other lifestyle factors. Dietary nitrate intake is one of those.
Mhm.
Do individuals need to take nitrates for the rest of their life? Possibly, because we are always up against the clock of oxidative stress, both through just the natural aging process, but then this exposure we have through lifestyle. If we
Mhm.
don't exercise, we get endothelial dysfunction due to oxidative stress. If we over exercise, we can create oxidative stress.
And increase
Physical,
stress.
mental, emotional stress is creating oxidative stress, environmental toxins, and we can only do so much in that realm to clean our homes and our lives from those things. We're always going to have some exposure. So when we know that endothelial tissue, which is where nitric oxide is produced in the body, we know that's declining. We know that it's age related. We know that by about age 40, you've lost about 50% of your capacity to make adequate nitric oxide in your body. I'm over 40, I'm over 50. I want to make sure that I have healthy vascular function so that I am maintaining my blood pressure, my heart rate, protecting my heart health as I go forward. I will continue to take dietary nitrate supplementation daily, testing
Mhm.
for my levels, making sure I'm staying adequate for the rest of my life because I like the energy I feel, I like the mental clarity I have, and I want to carry that forward in my years.
No, well, that's all wonderful. And I do love the nutritional and simplicity of even the vitamins. And I would just say that I usually will say like a multivitamin. Some people will have some hair issues, so sometimes we're using a multivitamin like a Nutrafol that like actually supports hair. But I say multivitamin in addition to like what you just mentioned is great. And I do find that if people think like in medicine, we wait for a disease to happen and then we place people on medicine, and medical doctors, the medical society is not taught to place somebody on medicine with the idea of ever taking them off. And so, if we think about it that way, why would we stop our supplements that are helping us prevent some diseases? And so, if we can take a medicine daily for the rest of our life, and again, I don't agree with that approach, but that's how we've been trained, and that's how a lot of patients are still treated. And so, I think that taking a supplement is a much better option, right? And so, and I have heard from at least one person kind of close to us in the back of the scene. I might not mention that he's like the videographer, but every time I ask him to take his Berkeley Life, he's like, am I going to get like addicted to this stuff? Am I going to get like where I depend on it? And I laugh every time because I mean, is that even possible that you're like addicted or dependent or need more? It's not. You're just like supplementing. So I think that's probably not an uncommon kind of question. But anyhow, or at least concept that if I start taking something, I just need to, now I can never stop taking it. Right. And I would say that's more of a
Right, it
medicine
is.
and not
Yeah.
a supplement. Yeah.
I do agree on the multivitamin. When I think of minerals, that's really where the mineral from the vegetables in the diet, from, nutrient dense foods, but a multivitamin mineral supplement is always a good recommendation because most of us just aren't, we're not getting the foods that the body was designed to get. They're just not as nutrient dense anymore. So augmenting that with, a capsule or two a day is a really great idea.
No, I agree with you. And there's one of my favorites that just has some plant based antioxidants in it too. So I feel like it's energizing in and of itself if they take it daily. And it's got minerals and everything you need, but nothing you don't, because I'm not a strong believer that, like calcium, for instance, is necessary in supplementation if we have what you just mentioned, vitamin D3 and lifestyle and sunlight, all those good things. So,
And leafy green vegetables are a good source of calcium too. So we need to remember that too. People tend to think it only comes from dairy products, but it's simply not true. The vegetable world has a lot to offer in terms of the primary nutrients we need.
yeah. And I think that, like, your background is just perfect for functional medicine, regenerative medicine, because that nutrition does play a huge part. It's one piece of a framework to feeling your best, and people do have to do their part with that. And again, I like simple. So I say the perimeter of the store is where you should stay. And
Perfect.
because then you're just not going into all the processed areas. So if I was to keep it simple, you're just going around the outside
Mhm.
and the perimeter and hitting, everything you talked about.
That's the best advice.
And protein, 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 which is exactly what you said. So I love your background with this. And then again, so they're taking it on a daily basis, because I'll always
Mhm.
end up saying that these, like those basic supplements that you need, or if we discover any other ones with blood work. But one of the questions I have with studies, now that you brought up the hormone component of it, kind of, is that I wonder if ever they'll do some blood test related to, since they have some symptom control, such as hot flashes with some vasomotor stability with increased nitric oxide or the Berkeley Life supplementation. I wonder if ever they'll think about testing some hormone responses in some way, because that is a blood test that they might be able to do.
Yeah, I can sneak peek a little bit into the future in that Berkeley Life is working with a scientific advisory board. We do have a study in consideration that will be specifically targeting menopausal women, looking at those hormone responses and looking at those vasomotor responses like the hot flashes, night sweats, sleep patterns, things like that. And one of the
Mhm.
goals is to do some laboratory collection and do some blood markers, and hormones will be included in that. So
Yeah.
stay tuned. It's the proposal for the study is still in the review stage. It has to go through the advisory board and through the review board for research. But we're really excited about what this particular researcher is bringing forward. And I do hope to see that connection because what is in the research shows us that with women, as estrogen declines during the perimenopausal transition years, we see a dramatic drop in nitric oxide production and a dramatic drop in endothelial tissue integrity. That's
Mhm.
important to your cardiovascular system because that's where the blood flow is happening. When we start to get those inflammatory effects, we get constrictions in the blood vessels. We are more at risk of hypertension, high blood pressure. We are more at risk of blood clotting, things like that. So we want to see there's science, and we hope to promote the science showing that by restoring nitric oxide levels, we can keep that endothelial tissue healthy and help prevent heart issues going forward as estrogen is declining. That isn't to say that some women wouldn't benefit from hormone replacement therapy. I can
Mhm.
tell you that with the other regenerative medicine providers we work with, we hear a lot of stories about nitric oxide support, dietary nitrate support, improving the efficacy of their hormone replacement therapy, helping physicians like yourself keep doses a little bit lower at an effective rate, and improving health of that blood vessel integrity going forward as well too. So I see it win-win.
Yeah, no, I agree. And I think that it's a frame, like it's all going to be, hormones are always going to be part of a framework to feeling your best as you get older for both men and women. But it depends on the importance of that, depending on the patient, right? And so some can't take it, some are afraid of it. So I think that the dietary and the nutritionist, they're part of it. You know, their lifestyle and their fitness level and their activities and their nutrition is another part of it, supplements. I think it's a comprehensive way to do it. People may not be all on board for doing the hormones, but it definitely is a component that needs to be looked at. And for me, I'll never not believe that it doesn't, play a role in almost everyone that we can bring back, but we approach it comprehensively with the supplements. And in some patients, it's not for everyone though, right? So whether they can take it or whether they can't is an individual decision, but we're just here to guide. In the female sexual wellness part, I think that all women have, like, we're talking more and more, and you see this, about perimenopause and menopause. And since we're both, of that age where we can talk to this, like, we've been left behind and we're finally just starting to talk about it, and we're expecting medicine to change like immediately, right? But it's not going to change immediately. We can't suddenly decide that all the doctors should have known about it, now they should be offering it. But we're starting to talk about it and educate, which I love. What we're not doing yet is talking about how those hormones affect sexual function and what we can do about it. And that's why I loved this study when I saw it, because this is something that women can take to improve things immediately. And I love the fact that it was desire, lubrication, pain, libido. So across the board, everything that we talk about from a female sexual dysfunction. And I think that's the one thing we haven't yet done, is kind of say, how do the hormones affect, what can we do to improve the sexual changes that we experience as we get older. So it was super exciting to see this study.
Thank you. I'm also excited to see it and see more of it and keep this conversation going. And, as we know, the research funding is limited, and it's hard to get the dollars unless we talk about it more, and unless women are talking about the quality of life symptoms that matter to them. So the more we have these kinds of conversations, the more we're going to generate the interest, and the researchers and the universities and the labs are going to start picking up on, this is a really important topic, and let's get this funding going, and let's get this research on the way. So talk to your doctors about it, ladies. Talk about how much you want to be part of the solution.
Well, and the more and more that they talk about the changes, so a lot of women will sit around and potentially talk about the hot flashes they're having, but they're not going to talk about the vaginal dryness or the fact that their orgasmic strength is significantly decreased. All of those things, people aren't, and men aren't talking about that either, with their friends. But we haven't even really had an avenue for talking about that with medical professionals or our doctors. We don't get educated in medical school, and you can ask one or two questions and you're pretty much shut down in the doctor's office because they don't know how to have those conversations. And I'm traditionally trained, so I know that. But I think that it's important that we are able to have those conversations and know that we don't have to live with that we can have, the same sexual function we had in our 20s and 30s throughout life. And so we just need to know that there's lots of things we can do to get that back.
Yeah, absolutely. 100% agree.
Yeah, so I'm excited about that, and I'm excited that as we move to bring that sexual, focus into medicine, that women don't have to, be hesitant to have those conversations, ask those questions, all those taboo things we haven't been able to talk about. Then when women really start to push to not have to accept, in silence, I think then we'll make some progress, Cathy, right?
Yes, exactly. It's easy. I think it's easier to talk about male sexual function simply because the reproductive organ is pretty visible. It's pretty obvious when it's functional or not. And women
Mhm.
don't tend to think about the fact that they also need tissue perfusion. They need blood flow. They need their reproductive organs to be engorged, just like a man does, for
Yes.
receptivity, for lubrication, all that. So we have to that's the other part of the conversation is really being self-aware and bringing those signs and symptoms to the conversation with a physician. So paying a little better attention. Sex doesn't have to be painful. It should be enjoyable. If you are noticing a lack of desire, low libido, you're just not able to get aroused, then those are signs that there is an underlying root cause that we can investigate and help you get rid of those signs and have a more healthy sexual function going forward.
Yeah, no, I agree. And also, our organs and tissues go through so many changes with childbirth and vaginal deliveries. So it isn't as if it's just protruding. It also isn't protruding and goes through a ton of, not traumatic, but like physical changes over time. And so
Sure.
pregnancies
Yeah.
and deliveries and all that. So, yeah, women, you deserve to have great sex for the rest of your life. And so this is an important conversation to have. And this is just one step in a supplement that gives you nutritional, value back to making that nitric oxide over time with an immediate improvement. And because you're talking
Yes.
about a very short duration with a significant, and I will say that because a lot of critics tend to look at surveys like this or a percent as if it's a bad thing, but honestly, most female sexual function has been surveys over time, and because it's almost like where medicine meets the big black box of medicine, where they don't know anything about the vagina for the reasons you mentioned. It's inside, it's up there, nobody knows anything. And it's surveys is how we know things for the most part. So I think that's important because it's how women feel. Yeah.
Absolutely. And maybe a good suggestion for women is to simply go online and research the Female Sexual Function Index,
Yeah.
FSFI. You can
Mhm.
download it. You could have a copy printed in your bathroom. You could take a look at it every day. That's a way to create body awareness and, mind body awareness about those signs. And then
Mhm.
that allows you to have the conversation with your physician and say, look, I found this survey and I realized I have, 27 out of the 30 signs. And let's talk about that. I think that's a great way to get us to self-report a little bit more accurately too, is just to create that awareness.
I think that is great advice, but I think their primary physicians will probably be like, what are you talking about? Like, what is this index? So, but I will say that there's like two versions. We do that as an intake form because, again, we ask all the things from a sexual standpoint and have since I opened the practice. But there's a shorter version too, which I like. So there's that 19. There's the longer version and it goes into
Mhm.
depth, but there also is like a 6 question one that just addresses the libido, the arousal, the orgasmic strength, each one individually. So even if they answer yes to any of those, and we can always put a link, in the description that talks a little bit about the FSFIs, and then they can have that there. So that might be a better way. And then at least they know that they have one of them with just a 6 question. You
Great.
just answer the 6 questions and you're going to know whether you have an issue with one of those. And at least this is a good place to start. And then you're right, potentially taking it to your gynecologist or your primary care or finding somebody that specializes in hormones or, sexual wellness. But there's solutions there. That's the important thing. And hopefully these conversations will get more popular and more open over time, and let us know at some point. We're doing a women's roundtable and we're going to talk to women kind of across the board about different things related to sex, and you can always partake in that if you want to. So
I'd love to help initiate that conversation. I'm not shy. I will talk about it, and I will draw the questions out of other women too. So
There's an option. All right. That sounds perfect. Well, is there anything else that I missed or that we missed related to at least the Berkeley Life when it came to, the nitric oxide production, but also the female sexual wellness? Because otherwise, we're going to get on and talk about the other studies as you guys do them.
yeah, I think the only thing I would add is that, just like men have been using nitric oxide support, whether it's beetroot juice or an arginine-based supplement for erectile dysfunction, women can think that way too. And this is where the Berkeley Life test strips come in. If you anticipate that it's Tuesday night, the kids are busy, we, have our planned encounter for Tuesday night, and you want to be more prepared to have your sexual function be optimized, test your nitric oxide levels in the afternoon, plan ahead. We know that through the digestive pathway, it takes 45 minutes to 90 minutes to feel the effects of those nitrates doing what they're supposed to do, improving blood flow, increasing oxygenation, improving energy. So you can plan ahead, and it's okay to take an extra dose of a dietary nitrate support, or perhaps chew our prebiotic nitrate gum. That's another way that you can sort of prepare for improved physical performance, if you will, in a sexual capacity. And I think it's totally okay to think that way, that you want to feel optimized for those special moments in your life. And it's okay to boost yourself a little bit with some nitric oxide by taking some support more, in an as needed measure rather than just preventive every day. You can boost yourself a little bit. I
Yeah.
talk to lots of women about doing that, and they're like, really? I can do that? It's like, yes, girl, you can do that. And that's where then we get the clinical testimonials about desire, libido, lubrication, and that's where we know it's really working sort of almost in the moment, a little bit of planning ahead, but it's okay to take with dinner if you anticipate some activity later in the evening.
Perfect. And I would take that one step further because the little blue pill, or Viagra Cialis can also be used by women in a low dose. That's anti-inflammatory with increased blood flow as well. But you still need nitric oxide production for a PD5 inhibitor or Cialis Viagra, ingredients to work. So you can take that prior to, or even on a daily basis if it's a low dose. And we have like a nice combination, one that we use for both men and women that they love. And it's a low dose of both. So you get that long acting, short acting. You can take it daily, just like the Berkeley Life. And it improves the blood flow and sexual function and experience. So, yeah, I agree with you. Those same supplements or tools are available for women too. Well, perfect. Well, all right. Well, thank you so much, Cathy, for being on. And again, Cathy's with Berkeley Life. She's the Chief Science Officer. And as they do more studies, we're going to be on again talking about those. And thank you so much for being with us today and taking time out of your day to share this exciting product and study with us.